A few years ago, while I was a medical student rotating through a clinic in Kingston, Jamaica, I met a patient that would change the course of my career in healthcare towards becoming a sexual health advocate, women's rights activist, and founder of the Access Sexual Health movement. Into the clinic walked a terrified 17-year-old Hannah, who was pregnant and presenting with a smelly discharge coming from her vagina. Unsure of what to do, Hannah took a toothbrush that she wrapped into a rag to clean inside her vagina. As we spoke further, she confided that she was not ready to have a baby, nor did she have any family support. So she had been attempting to have an abortion using home remedies. When the discharge came, Hannah thought it was the dead baby oozing out of her. Women aren't the only ones affected by sexual health myths and misconceptions. In fact, I remember Kevin, a young man who confidently stated he didn't need to use protection while having sex because he was immune to getting STDs. As he spoke further, he said he frequently used antibiotics to treat a heart condition, and this is what Kevin thought gave him immunity. I could still remember the look of terror on Kevin's face when I told him he was not at all protected against HIV and other STDs. I then asked other physicians working in different parts of the Caribbean about some of the myths and misconceptions they have come across in their practice. Some shared that some women would use bleach or vinegar or even Pepsi to wipe their vaginas, thinking it would protect them from getting an STD. Or if they use it in sex positions like standing or the woman on top, or if they had sex in water, because of gravity, it would prevent them from getting pregnant. Another example, using 2 condoms at once would give double the protection against HIV. Or if they had too much sex, it would make the vagina slack. So, let's talk about the consequence of poor sexual health on developing countries. There are approximately 225 million women across the globe with an unmet need for contraception. And 8 out of 10 women with a curable sexually transmitted disease living in a developing country would not receive treatment. Maternal mortality is the highest cause of death among girls 15 to 19. And in the Caribbean in 2008, there were approximately 1.2 million births, and 63% of those were estimated to be unintended. So, why is this important? Well, because poor sexual health causes major challenges, especially in developing countries with struggling economies. This is so because it impacts all aspects of human life. So, let's talk about this impact in regards to 17-year-old Hannah and her unwanted pregnancy. As a consequence, she has reduced opportunities for educational attainment and increased risk of remaining in poverty as she struggles to care for her unwanted baby. She also has increased risk of poor physical health, attempting unsafe practices to have an abortion, not to mention the emotional distress she's likely to experience. And this doesn't take into account the cost to society. Hannah's unwanted pregnancy increases the burden on the public healthcare system, reduces opportunity for economic development, and increases the risk of unstable family structures. So, what has been tried? Even though there is an increase in effort to promote sexual health and to provide contraception, there are still many barriers. Many sexual health campaigns are abstinence-only campaigns, which are ineffective because they fail to equip young people with the information they need to make appropriate choices. In fact, by the time young people have access to this inadequate information, they are already sexually active. Other barriers include discrimination against marginalized groups, cultural taboos and myths, as well as policies and legislation. So, how do we solve the global challenge of poor sexual health? Well, for one, we need a method to talk to everyone about sex that is positive and non-discriminatory. Because of my first-hand experiences seeing these challenges in developing countries, I've dedicated my life's work to promoting sexual health, and this has led to the formation of our organization, Access Sexual Health. We now have an international team of volunteers involved in the sexual health movement, and we're growing daily. Access Sexual Health not only connects young people to services they desperately need, but uses mediums they could easily relate to. While we continue to provide these services in circles where young people have access, we're focusing our attention on expanding our reach using digital media in the form of mobile health technology. Mobile health technology is the use of mobile devices in medical and public health practice. It encompasses mobile telecommunications as well as software that targets health. Its aim is to provide a personalized approach to disease management and healthcare that is easily accessible to the user at the touch of a button. And we're currently using this to provide sexual health services in the form of STI testing, access to contraception, and education that can be tailored to the needs of the user. This empowers the user to take full control over their sexual health. With increased ease of access and improved communication resulting from this platform, there's a reduced need for inpatient clinic visits, allowing for better allocation of already scarce resources. We could also use it to support clinical staff by providing updates as well as support in managing difficult cases. And data harnessed from the platform can also be used to support governments, researchers, and policymakers in streamlining their approaches to those in greatest need. So, how will it work in practice? Well, for one, it could help somebody like John, who probably won't visit a health center to learn the correct way to use a condom, but he may view a video on our platform, which he could also use to order condoms discreetly. Or Hannah, who had unprotected sex and is terrified, and she needs to know urgently what she can do. She may benefit from texting a sex health provider her questions, or having an online chat with one. Or even Kevin, who was recently diagnosed with HIV and feels alone and afraid. He may benefit from having an online support group where he doesn't have to reveal his identity. So, this sounds like a great idea, but can it work in developing countries? The answer is yes. Developing countries are great environments for mobile health technology. There are currently 6 billion mobile phones across the globe, and 75% of the world have access to mobile phones. Developing countries don't only account for the majority of mobile phone subscribers, but will account for 80% of the new ones. In my country, Trinidad and Tobago, there are 1.47 mobile phone subscriptions per inhabitants, and 65% of the island have access to internet. And we already have success stories coming out of the use of these platforms. For example, in Kenya, simply using text messaging between a healthcare provider and someone diagnosed with HIV increased adherence to antiretroviral therapy, allowing them to be healthier. And this youth activist from Cameroon called Malo created a platform called Medolo 360, which received great reviews from its users because it provided answers without having to face discrimination. So, in general, mobile health technology can be a powerful tool in providing sexual health services, access, filling equity gaps, and filling coverage gaps as well, especially in low-resource settings. I strongly believe that the greatest motivator for the use of this platform is its potential to help tens of thousands of people live healthier lives. Even though mobile health technology is developing and has its challenges, it's difficult to ignore the enormous potential of this platform. Therefore, the question should not be if we should use it, but how we can use it to provide sexual health, especially in settings where it's of greatest need. We need to do this for people like Hannah, Kevin, and many others like them. Thank you.